Hi, my name is Dr. John Schnorr. I'm one of the founding partners of Coastal Fertility Specialists, and I'm glad to be here with you today. I wanted to talk with you about a very common disorder called male factor infertility. Male factor infertility affects about 40% of all couples with infertility, and it's just that. It's infertility caused from men from typically lower sperm counts. The way to make the diagnosis of male factor infertility is actually very easily. We just do a semen analysis. And by doing a semen analysis, we can count the number of sperm which are present. We can look at the motility of the sperm to make sure they're moving well. And we can look at the shape of the sperm to make sure they all have a normal shape. Turns out that the way to do a semen analysis is through a sperm collection, which is done with about 2 days, 48 hours or so of abstinence. And then with that semen analysis, within about 2 to 3 days, we'll have results and can understand if there's any evidence of male factor infertility. A normal sperm count by the World Health Organization is determined to be greater than 15 million sperm per milliliter. Generally greater than 40% of the sperm should be moving. And when you look at the shape of sperm under a microscope, on average, around 4 to 5% or more of the sperm should have a normal shape. Of all the factors we look at, it's clearly the amount of sperm and the motility of the sperm that are the best predictors of male factor infertility. The shape of the sperm actually over multiple years has shown us that sperm shape has a very small, if any, contribution to male factor infertility. I had a patient not too long ago who they had no normal sperm whatsoever. We checked it on multiple occasions. I called to give her that information, and at the time that I was calling her, she let me know that she had conceived spontaneously, which is just that the shape of sperm does not predict the likelihood of infertility with regular intercourse or even with ovulation induction and intrauterine insemination. It may play a role if we ultimately need in vitro fertilization, and that's easily bypassed with a process called ICSI, which is intracytoplasmic sperm injection. You can learn more about that through some of my other videos. Male factor infertility, again, affects about 40% of all men. Most men don't have any history that actually points us to that, but common causes of male factor infertility can be a man who's had chemotherapy in the past or radiation therapy, a man who's had testicular torsion or testicular surgery, a man who's had a vasectomy where the tube has been disconnected to cause infertility and then the tube was later put back together. That tube being called the vas deferens can be a cause of male factor infertility. Some men are born with genetic abnormalities which can cause male factor infertility. Common causes that we think about, we try to differentiate male factor infertility from what we call obstructive causes, where there's a blockage in the reproductive tract, to non-obstructive causes. Most infertility for men is called non-obstructive infertility. And so what we start with is a semen analysis, a consult to discuss the semen analysis, and then testing. When we're doing testing, we're trying to again differentiate obstructive versus non-obstructive, and we do that first by doing hormone levels. Men's hormone levels are the best if done measured before 11 a.m. So before 11 a.m. we like to measure his FSH level, his testosterone level to make sure his testosterone level is okay. Commonly we do inhibin levels, estradiol levels, prolactin levels, and TSH levels. That's a thyroid hormone level. And with that we can understand whether there's any hormonal causes of male factor infertility. If you have 100 men in the room, about 5 out of the 100 are going to have a hormonal cause, and if they have a hormonal cause, that's generally something that we can treat by giving him hormones. Another common cause of male factor infertility can be genetic abnormalities, where the genes got rearranged in his body and that made it so that when he makes sperm, sperm has an increased risk of having a genetic abnormality. Sometimes that can be a rearrangement of the chromosomes or can be a deletion of a specific gene on the Y chromosome responsible for making sperm. If you have 100 men in the room, probably around 3 to 5 out of the 100 will have a genetic cause. I think that's important to look for because ultimately if we use that sperm to help you conceive, we're going to want to know that the sperm is genetically normal, and so doing genetic testing is highly recommended. There can be anatomic causes of male factor infertility. Those can be varicose veins that can form in the testicle called a varicocele that actually for men kind of feels like a bag of worms, is described in the scrotum, in the testicle and the scrotum, and causes pain, kind of dull discomfort for men when they're exercising and doing activities. And we would refer you to a urologist who would spend some time and do a physical exam and look for any varicoceles. If varicoceles are present, in some cases they can be resected during a surgery, which can improve the sperm count. Studies are controversial on that, but we think the quality of the sperm probably increases with surgery, but not the quantity. Pregnancy rates generally don't improve too much with a varicocele surgery. We'd encourage you to follow up with the urologist to discuss that in a little bit more detail to see whether that's relevant or not. Other things that we think about is maybe the cells in the testicle aren't making sperm well. We know that sperm is made through cells that are in both of the testicles. Men have millions and millions of these gonadal cells which actually make sperm. The time to make sperm takes about 3 months on average to make sperm. And if a man was born with a low number of these cells, maybe just a genetic abnormality at birth or through undescended testicles or maybe some injury to the testicle where these cells got hurt, then it turns out that there's not enough cells in the manufacturing line to make sperm, and therefore the sperm count is low. We also know that sometimes men can go through it in a way a male menopause, where their testicle starts to wear out. We note that by having elevated FSH levels which are present and typically low testosterone levels. So that would be a sign that the testicle is starting to wear out and men might be going through a male menopause. What's important about this discussion is a couple of things. Number one, male factor infertility is one of the most curable forms of infertility. Sometimes we need to get fancy to do that. Simpler forms of treatment like ovulation induction and intrauterine insemination is typically not helpful for male factor infertility. We need to start talking about in vitro fertilization with ICSI. In situations where there's not any sperm present at all, often we can do a testicular biopsy to get sperm out, and yes, that's done under anesthesia. And then once the sperm's retrieved, we can then do IVF with ICSI, which allows us to fertilize the eggs and then make embryos, and then we can grow the embryos out with very good pregnancy rates. And frequently through those forms of treatments, even worse, the worst male factor infertility, if we can get sperm, pregnancy rates are equal to the female's age and her testing. So it's very treatable with in vitro fertilization with ICSI. A lot of questions are about, do we increase the risk of birth defects? There does appear to be a slight increased risk of birth defects if you conceive with severe male factor infertility and with ICSI. We think that's because the sperm have a slight increased risk of having chromosomal abnormalities. Overall, if you conceive on your own and your sperm count's normal, you generally have about a 2 to 3% chance of having a child with a birth defect in general. If you have severe male factor infertility, that increased risk birth defect might be as high as 3 to 4%. And most of those are genetic abnormalities that again would be associated with the sperm having problems. It is an increased risk of having a birth defect, but generally thought to be overall a relatively low chance in the 3 to 4% range. Another thing that's important to know is that giving a man testosterone is like giving a woman a birth control pill. So taking testosterone would further lower the sperm counts and would be the wrong thing to do. Once a man stops testosterone treatment, it often takes 6 months to a year for the sperm count to return to normal. So we'd encourage men not to be taking testosterone. So the summary is that male factor infertility is very common. It's very treatable. We want to do some testing so we know the causes, figure out if we can treat it the simpler ways. If we cannot treat it the simpler ways, then we start talking about in vitro fertilization with ICSI, which has very good pregnancy rates. I appreciate you spending time here with me today. If you have any questions, feel free to call the office. We can work through this and find the cause and get everything treated for you with very high success rates. We'll see you soon. Have a great week.